Hi, I'm Felicia and I'm currently documenting a difficult journey I've had through the healthcare system in the UK trying to get the diagnosis and treatment for facial pain. I'm doing this in the hope of bringing urgent medical intervention for myself, but also to raise awareness about some of the issues I face within the healthcare system, namely lack of accountability and transparency, gaslighting and discrimination, to prevent harm coming to others. This particular video is about my experiences at the North Manchester General Hospital. My story is one of failed healthcare, of miscommunication and an ongoing battle for proper treatment. My previous GP referred me to an oral maxillofacial surgeon at the North Manchester General in 2017 about the pain in my left parotid gland. The parotid gland is a salivary gland that sits either side of the face, just under the ear, and it makes and produces saliva and deposits it into the mouth through a duct. I have had infection and inflammation and pain in my parotid gland since 2013. And in 2015, Guy's Hospital found that there was obstruction and a thickening of saliva, basically glandular malfunction in my gland, that they treated with saline endoscopies and washouts, but sadly prematurely discharged me. The parotid gland presents huge difficulties for surgeons, whether it's benign pathology or cancerous pathology, because the seventh cranial nerve, which controls the movement of our face, runs directly through the gland, making any kind of surgery incredibly difficult to carry out. This is why they use minimally invasive procedures to begin with, which is what they did. When I first saw the surgeon, he agreed to do a superficial parotidectomy, which is the removal of the superficial part of my gland. But he didn't do a scan first. He did it based on the clinical findings at Guy's Hospital. He operated blind. When I woke up from surgery, I came through surgery with severe facial nerve palsy. This is a common after effect from parotid gland surgery. With the help of a physiotherapist from the Linden's Clinic in Timperley, I recovered full facial function in 4 months. The histology of the gland came back abnormal. It showed dense secretions in the ducts, calcified tissue and reactive lymph nodes. The parenchyma was ciliolitharsis. Obviously, I had some relief because he'd removed some of the gland. But the issue is the surgeon left a huge amount of my gland in. Now, we never said he'd take it all out, but a scan in America a year later showed that there is still some of my superficial lobe left. The deep lobe is there, and there is some accessory parotid tissue over my masseter muscle, and the duct, which is damaged and thinned, is still connected to the gland. He didn't cut it and tie it up, which many surgeons do. In addition to this, neither the surgeon or the infectious diseases department, who I saw once, cultured my tissue to find out what bacteria was causing this. Now, this is particularly frustrating in light of the fact the surgeon knew that infection is the cause of my pain. He wrote on the diagnosis, repeated infections in the parotid gland. The Manchester Royal Infirmary, the oral maxillofacial department, wrote to both he and the infectious diseases department, asking them to test my gland for rare infectious diseases like Bartonella infection that I haven't been tested for, but they point blank refused. This was a missed opportunity. Had they cultured my gland, we may have been able to find what bacteria is causing this potentially very unusual infection, or any other bacteria that they may have found a number of things, but the fact is they didn't. The main issue that I've left with is that I have severe pain in my remaining parotid gland. It's rock hard, it burns, it pulls, and I cannot find a surgeon to remove the rest of it. I've seen over 7 or 8 surgeons, head and neck surgeons in the UK, high caliber surgeons, who have all said they will not touch me because of the risk of further paralysis. This is a tough predicament to be in, because effectively, if it's left in, I'll have pain in there for the rest of my life, which I can't live with. Whilst removing the rest of my gland won't cure or deal with the potential abnormality they found in the masseter muscle, the buccal fat pad, the periocular pain I've got, or the head pain, it will solve a massive part of the problem. I guess I want to use this video to speak directly to the head and neck surgical world, because I've spoken to you many times, but I don't feel you've heard me. And this is what I want to say. I fully understand your reasons for not operating. You don't want to hurt me. I get that. It makes sense. And I also know that removing the rest of it, there is a high risk of permanent or temporary palsy. But I want you to hear that I cannot live with this pain for the rest of my life. It needs to come out. There's disease in there. Whether it's benign, whether or not it's turned into cancer, we don't know because I haven't been seen for years. But as we know, it's benign disease. But benign disease still hurts. Infection hurts. I guess what I want to say is this. If I had the choice between facial nerve palsy or pain, I would choose the facial nerve palsy. When I lived with the facial nerve palsy before, I was still able to function. I could eat, I could drink, I could speak, and I could write. And most importantly, I could still connect with other humans. Yes, I lost my looks, whatever they may be, and I lost my ability to smile and express emotion, and I'm not downplaying that. That is tough. But I would still choose paralysis over this pain. I've also said to you, and I'm saying to you here publicly, that I would sign a disclaimer and sign off any liability for a comeback on paralysis. I would sign anything, which meant that if I was left with paralysis, there would be no legal comeback on you whatsoever. If there is a head and neck surgeon out there, either in England or anywhere in the world, who would be willing to have an honest conversation with me about the potential of removing the gland, whether it's private or on the NHS, please come forward. This has been a problem that has plagued me for so many years, and I just want this thing out of my face. It feels like an animal in there. It moves, it's gnarly. It's agony, and I will work with you for as long as it takes to get it out. My experience at the North Manchester General was terrible. They did a half-cut job. They went in, took out some of my gland, went in blind, didn't culture the scan, and didn't culture the tissue, and have left me with a difficult predicament vis-a-vis the head and neck world. It's just not good enough. We deserve better care. We deserve better communication. And we deserve more transparency about intentions with surgery. He didn't say he was going to take it all out, but I assumed he was going to cut and take out that duct, which he didn't do. It's just not good enough. And it's caused years and years and years of pain, confusion and frustration in this really tough battle I've had with the head and neck world trying to get the rest of it removed. It really has. And it could have been dealt with differently. If anyone can come forward, please contact me. You can reach me at info@myfacialpain.com, @myfacialpain on Twitter, @myfacialpain on TikTok. Thank you for watching.